Hi, I'm Dr. R. Singh and I'm talking to you from Durban, South Africa on a lovely spring day. Today is the 13th of October 2020. Yes, it is spring in the Southern Hemisphere. I know it's autumn in the Northern Hemisphere. So welcome to Durban, South Africa. I'm a proud Durbanite. I'm a fourth generation South African. My son is a fifth generation South African. My great grandparents came to South Africa in 1892. We live in the beautiful city of Durban. People haven't heard of Durban, but it's one of the biggest cities in South Africa. It's the fifth busiest harbour in the world. We call Durban the Cinderella city because it's only one of the few cities, I think Durban and Cape Town are the only two cities in the entire world that hosted a World Cup semi-final in soccer, a World Cup semi-final in rugby, and a World Cup semi-final in cricket. That's why we call it the Cinderella city, because the final is always hosted in Johannesburg. I think you're not aware that Johannesburg and London is the only cities in the world that hosted both the World Cup final, a cricket World Cup final, a soccer World Cup final, and a rugby World Cup final. In South Africa, we have lots of challenges with the liposuction. Lots of our fellow colleagues do not like us doing liposuction. They feel that we should be traditional dermatologists doing the big five. The big five is acne, eczema, psoriasis, skin cancers, and pigmentation. But as a dermatological surgeon, I do liposuction. For that, I have to pay a slightly higher insurance bill. As you can see, I belong to many societies. My training was mostly due to the mentorship of Professor Larry Fields. He also made me a member of the International Traveling Mentor Program of the ASDS. Today it gives me great pleasure to talk to you on the laser liposuction. I'm going to do a special laser liposuction. Apart from the traditional laser liposuction, I'm also going to introduce you to two devices which I use, which is the Nd:YAG laser, which consists of a 1064 nanometer laser, and also the Ultra Z, which uses ultrasound. In my practice, I use a combination of all three, apart from the traditional liposuction. So without much further ado, I will introduce you into our laser liposuction. Once again, good morning, ladies and gentlemen, from a very rainy spring day in Durban. As I mentioned to you all, Durban is one of the finest cities in the world with about 260 days of sunshine. Unfortunately, the day we decide to make this video, we're not blessed with the sunshine. But nevertheless, today we have an exciting patient to discuss with you. We have Mrs. Ashley Singh. Mrs. Ashley Singh is a 47-year-old lady who's basically reaching the menopause, and she's having problems getting rid of some of the belly fat or the abdominal fat. So we've decided to help her, and she's very kindly agreed to be on part of our show. Good morning, Mrs. Singh.
Good morning, Doctor.
As is a tradition, before we used to shake hands, but now we're going to do the traditional South African one. Okay, so due to COVID. So Mrs. Singh has agreed to grace our show by her presence. So with the result, we're going to demonstrate exactly what we're going to do. Main problem with Mrs. Singh is her abdomen. She's worried about the abdominal fat, and she wants to look slim and trim. By the way, she's an ex-beauty queen, so she wants to get back to her being the beauty queen that she once was. So, Mrs. Singh, welcome to Durban. Can you come closer and show me the extent of your problem? Just pick this up, please, if you don't mind. Right. As you can see with Mrs. Singh, she has a problem with abdominal fat. Come through a little closer. So what we're going to do, the first thing we're going to do is mark the areas of a concern. Pick this up. So, the areas of a concern is the abdomen. So what we do is we find the ribs and we mark around the ribs. So this is the area that we're going to be targeting. We'll also try and turn around Mrs. Singh. We're also going to target some of this love handles. Turn around. So Mrs. Singh wants a tabletop stomach an abdomen that she had when she was a younger person. Of note, she has no children, and she's had a lot of numerous procedures, so you need to examine the patient extremely properly. The first thing we got to notice that this is relatively a virgin abdomen because there's been very minimal procedures done. We're not going to examine her here because, for example, she does not have any cesarean scars. There is no obvious hernia. In the event of you suspecting a hernia, then the patient needs to have an abdominal ultrasound because we cannot, hernia is a contraindication to liposuction. So Mrs. Singh has a relatively, what I would say, a normal abdomen with a slightly extra fat, which we're going to try and remove. Archnie has now changed. As you can see, she's even changed the underwear. She's now ready for going onto the bed. We check the consent form. It's very important that the surgeon checks every consent form and you explain the necessary procedure. Have you been explained the necessary procedure? You will be having a liposuction. It's going to take about 3 to 4 hours. You'll be having tumescent anesthetic and we'll be giving you a very mild sedation while you're having the liposuction. So please have a seat, Mrs. Singh. All right, as mentioned earlier on, we had marked the abdomen, but we're going to mark it again so that we do not hurt the ribs. So we read, as she's in the horizontal position, we are trying to mark out the ribs so that we do not injure her. We also find the anterior superior iliac spine, which is another area of concern, so that we do not injure her. We have a last minute. As you can see, she's had some abdominal scars due to some laparoscopic procedures, but otherwise she has a relatively decent abdomen. So before we start, we wipe the abdomen with antiseptic. We prefer to use iodine, as iodine is a very good antiseptic. Archnie, would you like some sedation?
Yes, please.
Since Archnie has requested for sedation, we will gonna try and help her with some sedation. Usually we give her Inderal, which is a beta blocker. But in this case, knowing Archnie from many years, I find she's quite an anxious patient, so we're going to give her some Domicum. So Domicum is a conscious sedation. As you can see, we will put up a drip on her, just in case we have any complications. We usually do not use sedation, but however, in anxious patients, we do use sedation. She's got lovely veins, as you can see, so it won't be a problem putting up a drip. Just to reconfirm, it is in the vein. We usually drop it and watch for a backflow. Thank you, put it up. You can see the drip is running perfectly. Just to make the drip more secure, in case we have any problems, I usually bandage them. A lot of people don't bandage them, but I usually bandage them. Okay, so before we start, my topic for Dazzle is to do laser-assisted and ultrasound-assisted liposuctions, in which we're going to use devices to help us with the liposuction, unlike the conventional liposuction, in which we only use cannula. But in this, we do both. So before we start, as I mentioned to you early on, we mix our tumescent anesthetic. With our tumescent anesthetic, we use a Klein pump. I managed to get a Klein pump into South Africa. It was a bit of a mission. We also have a backup pump, just in case our Klein pump does not work. It's very important. Some of the instruments that we use, these are some of the extractors that we use. For the very difficult areas, we use a very thin extractor. In the event of her wanting any fat transfer, we can also use one of our raspers, but we're not going to use a rasper today. But I'm doing this for the sake of completion. For the more difficult areas, we use these extractors. As you can see, they can extract because they have a slightly larger bore. We have our normal extraction. Of very great concern is sterilization. Patient safety is absolutely important. So we have a proper sterilizer, which is a steam sterilizer. We also have an ultraviolet sterilizer, where we store most of the instruments after they've been steamed. So we have sort of a dual type of what you call the sterilization. As you can see, most of the instruments are steam sterilized because unfortunately we have a high incidence of infection. We use the Ultra Z. This is a Korean machine. This gives you ultrasound, and then we use a laser lipolite, which is by Syneron, which gives you the laser liposuction. The Ultra Z gives up ultrasonic waves, which helps to melt the fat, whereas the laser liposuction melts the fat with Nd:YAG, which is a 1064 laser. As you can see, her blood pressure is slightly on the high side, I do think due to the anxiety. It's 155/94, and her pulse rate is 85, but the oxygen saturation is 100. So we're also going to offer her some beta blockers, which will help her both to bring the pulse rate, also calm the patient, but most important, it will also bring down the blood pressure. For suction, we have our typical suction pump. So we use our typical extraction pump, which I will show you a little later on. So we have a full resuscitation trolley, just in case. Touch wood, we haven't had any major problems, and hopefully this entire procedure will go smoothly. Her name is Kimeshri. She's from the south of Durban, and she's my main assistant. My other two assistants are Raquel and Lehmlata. We usually give a little anesthetic around the umbilicus. So what we do, we give an injection around the umbilicus. We make a small incision with a 2mm punch. Many colleagues use a blade. I prefer using a 2mm punch because it heals very well. And we will start introducing the tumescent. Ashni is 85 kilos, so our toxic dose on her will be 85 times 55. So Ashni should be quite numb with the anesthetic. We have made the 2 holes. Now we're going to use our introducer and use the tumescent. As you can see, we are introducing the tumescent. We usually go 1 quadrant at a time. That way we have control over the way we. As you can see, Ashni is an excellent patient. There's not even a sound from her. The Inderal is working, the Dormicum is working, her blood pressure is fine, and hopefully she'll be an excellent patient throughout this. As you can see, we finished 4 liters of anesthetic. I think we've achieved sufficient level of tumescent here. Now we're going to start the process of liposuction. As mentioned to you, we're going to ask the machine to help us rather than using our traditional one. But before we ask the machine to help us, I'll show you how we do the traditional one. These two cannulas are excellent liposuction cannulas. We don't have to use the machine, but if you want a better result and slightly less effort on the doctor, then you can use the machine. So I'll first show you the traditional liposuction. This is a typical liposuction cannula. We also use it for fat transfer. As you can see, it has a few serrated edges, but it's very, very easy onto the abdomen. And the first thing is, we can start extracting fat. As you can see, the fat is coming out. Ashni is a very happy person. No matter how much he went to the gym, this fat would have never came out. So this is a traditional liposuction that we were taught of by Professor Field. It's an excellent procedure if you want to save money, because the equipment in this room is well over $150,000. So if you want to save money, you can do the traditional liposuction. And as you can see, the patient is extremely happy because just by starting it, we're getting excellent results. And we're almost half a liter. All right, so this is our traditional liposuction. Now I'll go to our laser assisted liposuction. This machine cost in the region of about $50,000 US. And we're using the Z mode. The Z mode uses ultrasound to destroy the fat. So the consistency of the fat will be much, much smoother than the one that you do with the traditional liposuction. As you can see, with the ultrasound, it makes a characteristic sound. This is the ultrasonic waves that are destroying the fat. You let the machine do the work. All you need to do is to keep on using your probe, and the probe does the work. You'll find that the consistency of the fat is much different because this is ultrasound fat. This is not the traditional fat. So you do one quadrant at a time. You always protect the patient's ribs. As you can see, the consistency of the fat is much more different. Mrs. Singh is complaining of a little bit of tenderness, which is not unusual, so we're going to give a little bit more tumescent. Now that we've given her more anesthetic, we're going to do a little bit of extraction. We're going to use these. These are slightly more harsher, but because of the anesthetic, you shouldn't feel anymore. They will help us to extract a little bit more fat. From my experience of doing over 1,000 liposuctions, I think we should get about 3 kilograms. But we don't usually have a target. We're almost at 1.5 kilos. We may achieve up to 3 kilograms if that is our initial target. As you can see, all the resistant fat is coming out. As you can see, we're almost reaching 3 kilos. As you can see, we're taking out 3.5 kilos. We may even reach 4 kilos while we do the final touch-ups. Okay, this is the end of the liposuction. As you can see, we use the Ultra Z. We use the Lipolite for skin tightening. We took out almost 4.2 kilograms worth of fat. We're going to help the patient up. We usually give the patient, as she had an abdominal liposuction, we usually give the patient a corset. As she's slightly on the bigger side, so we use an extra large corset. And this corset also helps in getting the contour of the body together. This is an abdominal corset. As you can see, it has a zip over here, which helps you to maintain the tightness you need. And this corset here helps you to maintain your body contour. We use a Sipiro band for the holes or the incisions that we made. Have a seat, Mrs. Singh. How are you feeling, Mrs. Singh, after the...
Perfectly fine.
As you can see, this procedure here, she walked in. She had a procedure. We took out almost 3.5 kilograms worth of fat and the fluid, obviously. And after that, she's perfectly fine. We are going to instruct her to go home. She's allergic to penicillin, so most probably we'll give her one of the ciprofloxacin. She's also allergic to the COX-2 inhibitors, so I'll have to give her something maybe with the paracetamol and codeine. And she'll have a lovely night's sleep. She will review tomorrow, and then I will show you all the photographs. And thank you for giving us the opportunity of coming over, and have a safe journey home. If there's any questions, you're welcome to email me. My email address is at the bottom, or you can visit my website. Thank you, colleagues. It's a real pleasure to be on this laser liposuction. Once again, wherever Prof. Field is, may his soul rest in peace.